Okay. If you're scribing for the patient, after you finish your provider tab and the doctor's given you the findings, you have to go into assessment and plan. Under assessment and plan, you may find some of their prior diagnoses here. If they're a new patient, this will be blank. In some of the providers, we have some of our favorite diagnoses down here. Some of the logins don't have that. If you don't have a diagnosis you're looking for, you just hit diagnosis lookup and you can type something in. Let's type in cataract. So then you'll type in cataract and you can see there's different types of cataracts. So typically we're gonna have this age-related nuclear cataract and you can hit select. If you selected something over here, let's say they have blepharitis, it will add here. Anything you put, I'm gonna just put a couple diagnoses here. Let's put dry eyes, we'll add here. If you want to write individually, then you can just click on, let's say we want to type about dry eyes. You can free type here. You can also use the quick plan if you just wanted to say dry eyes, explained artificial tears. You could click that, it'll give you a little explanation there. You could also go to OPH plan and then kind of click your own things, or also type in whatever you want. Or you can say up here, instructed to use artificial tears, hot compress. This would be kind of something people would do with the dry eyes. Then once you have everything you want, you can also write return to clinic. You hit save and close. Once you have it in here, you would need to add it to the grid. If you don't add it to grid, you're gonna lose what you just wrote. So you can add to grid. If you have diagnoses that kind of go together and you want to write one big general plan, you can just click this button that says general plan and it'll put everything together. And then you can type about it, and then you just want to make sure that you add to grid. Some providers have my phrases. If you were writing something about a chalazion, this provider has this in their my phrases, and then you can hit add to grid. Sometimes the my phrases may not be very personalized to the patient, so you need to make sure if you're clicking something under my phrases that it actually matches what the patient, what you're doing for the patient. Don't just assume it's exactly what the doctor wants to do. Once you have all your diagnoses in your plan, you have to go to the bottom and you have to create a patient plan. And then after that takes a short time, you're going to go back over to assessment and plan, and then you're going to hit generate note. That takes a little longer. Typically the provider likes to check off this little check mark here. And then you can go back to your assessment and plan and scroll to the top where you will find something called document library. Under document library, you want to write a letter. If it was an initial visit, you could do initial visit letter. If they were diabetic, you could do diabetic. If it was a follow-up, you could do a follow-up. For every annual exam, I would just do an initial letter. So we'll say this was their annual exam. We're going to do an initial letter. You can customize this if you needed to. If you needed to edit anything or you wanted to write anything, you can actually add to the note as well.